Hello everyone, thank you for joining us. Welcome to the Avexia webinar series. Our topic for today is the microbiome's role in fertility, pregnancy, and pediatric growth. My name is Christopher Chu. I'm the Director of Marketing for Avexia Diagnostics and will be your host. Today I have the distinct pleasure of being joined by an exciting guest, Nina Marie Rueda, who will be our presenter for this webinar. Nina Marie loves reading, hiking, sitting outside in the sun, and spending undistracted time with her husband and 3 children. As a traditionally trained naturopathic doctor who focuses on perennial and pediatric health, she helps families grow naturally. With individualized care, Nina Marie's clients receive help with getting and staying pregnant, and their children have help with constipation, chronic eczema, ADHD, ASD, and more. Without further delay, I'll now turn the webinar over to Nina Marie.
Welcome to the microbiome's role in fertility, pregnancy, and pediatric growth, where we're going to be addressing dysbiosis for thriving outcomes in perinatal and pediatric health. Hi, my name is Nina Marie. I'm a traditionally trained naturopathic doctor, and I'm thrilled to guide you through this in-depth exploration of how gut health profoundly shapes reproductive outcomes, maternal health, and childhood development. With decades of groundbreaking research on the gut microbiome at our fingertips, we can now confidently state that the gut isn't just the body's second brain, it's the control center for hormones, immune function, and overall health. This webinar is designed to provide a detailed understanding of microbiome dynamics at key life stages, fertility, pregnancy, and early childhood. We'll discuss how dysbiosis, a disruption in the balance of gut bacteria, can lead to complications like infertility, miscarriage, gestational diabetes, C-section, postpartum challenges, and even pediatric conditions like eczema, asthma, and failure to thrive. And we'll focus on how the GI map test specifically, with its precise detection of pathogens, keystone species, and opportunistic microbes, can empower practitioners to design targeted interventions. This tool allows us to go beyond guesswork and address root causes, enabling clients to achieve healthier pregnancies, better postpartum recovery, and thriving children. Today's discussion is a bit technical and grounded in the latest evidence-based research. We'll name some specific microbes and markers that ought to be considered. We'll delve into different patterns frequently seen in GI map results and outline actionable protocols that you can implement immediately in your practice. By the end of this session, you'll have a clear understanding of how specific gut microbes influence hormone regulation, immune modulation, and nutrient absorption, why microbiome health is essential for reducing complications during pregnancy and childbirth, and how early intervention in pediatric dysbiosis can prevent chronic conditions and promote optimal growth. Let's go ahead and dive into this rich topic. The human microbiome is a dense, dynamic ecosystem of trillions of microorganisms, including bacteria, viruses, and fungi. Found primarily in the GI tract, these microbes are more than just passive inhabitants. They are active participants in nearly every physiological process. First, let's discuss the immune system. About 70% of our immune cells reside in the gut-associated lymphoid tissue, or the GALT. Here, your commensal bacteria like Bifidobacterium or Lactobacillus will play critical roles in maintaining immune tolerance and preventing overactivation. For instance, Bifidobacterium infantis supports regulatory T cell development, helping the immune system distinguish between harmful invaders and harmless substances. And low levels of these bacteria are often seen in conditions like eczema and asthma, specifically in children. Next, the gut is central to hormone regulation. Microbes like Bacteroides fragilis produce beta-glucuronidase, which is an enzyme crucial for estrogen metabolism. However, dysbiosis can lead to overproduction of this enzyme, contributing to estrogen dominance, which is a known factor for infertility and miscarriage. On the flip side, though, insufficient Escherichia species may result in the lack of vitamin B12 production, and we know that a deficiency in this vitamin is strongly tied to recurrent pregnancy loss. During early development, the microbiome serves as an immune system trainer. The first 3 years of life are critical for establishing a diverse and balanced microbial population. Dysbiosis during this window, marked oftentimes by low Faecalibacterium prausnitzii or Roseburia levels, has been linked to the atopic march, which is a progressive cascade of eczema, which leads to allergies and then can lead to asthma. Finally, the gut microbiome communicates with other systems through the gut brain and gut liver axes. Short chain fatty acids like butyrate, produced by Faecalibacterium prausnitzii, are anti inflammatory and neuroprotective, directly influencing the brain. These pathways demonstrate why addressing the microbiome is critical, not only for gut health, but for systemic wellness. The GI map test empowers us as clinicians to identify specific imbalances in these critical pathways, helping us to craft precise, effective interventions. Now that we've laid this foundation, let's focus on the microbiome's specific role in fertility. Fertility begins in the gut. The balance of the microbiome directly impacts the hormonal and immune systems, which are critical for ovulation, implantation, and successful conception. Let's start with estrogen. Bacteroides fragilis produces beta glucuronidase, an enzyme that can reactivate estrogen by breaking it free from its conjugated form. While some beta glucuronidase activity is necessary, an overgrowth of Bacteroides fragilis can lead to excess estrogen or estrogen dominance. This imbalance can result in irregular cycles, anovulation, and endometrial hyperplasia, all of which negatively impact fertility. On the other end of the spectrum, though, low levels of Escherichia species are problematic because vitamin B12 and vitamin K are produced by it. Vitamin B12 is crucial for DNA synthesis and red blood cell formation. Deficiency in B12 has been linked to recurrent pregnancy loss, particularly in the first trimester. And the vaginal microbiome also plays a pivotal role. A healthy vaginal environment is dominated by lactobacillus species, which maintain a low pH, protecting against infections. Low levels of Lactobacillus crispatus or Lactobacillus gasseri can lead to vaginal dysbiosis, increasing the risk of conditions like bacterial vaginosis or BV and yeast infections. These conditions have been associated with infertility and poor pregnancy outcomes. Pathogens like Clostridium difficile or C. diff and Enterococcus faecalis are particularly concerning for women struggling to conceive. These opportunistic microbes can drive systemic inflammation, disrupt hormone production, and impair implantation. Identifying and addressing these pathogens through tools like the GI map allows us to intervene effectively. A targeted approach to fertility involves balancing these key microbes. For example, reducing Bacteroides fragilis overgrowth, boosting Lactobacillus species, and addressing nutrient deficiencies caused by low Escherichia species can all help restore fertility. Using the GI map as a screening or diagnostic tool ensures that we're addressing the right targets for each individual. Miscarriage is a devastating event, and gut health often plays a hidden role in early pregnancy loss. Inflammation and hormonal imbalances are two major factors, both of which are heavily influenced by the gut microbiome. Let's begin with H. pylori, a pathogen frequently identified in GI map results. H. pylori disrupts gastric acid production, impairing nutrient absorption, especially of vitamin B12, iron, and folate or vitamin B9. Additionally, H. pylori has been shown to suppress progesterone production, a hormone critical for maintaining pregnancy. Without adequate progesterone, the uterine lining can't support implementation, which can lead to early loss. C. diff or Clostridium difficile, often associated with antibiotic use, can increase inflammation by damaging the intestinal barrier. This allows endotoxins like lipopolysaccharides or LPS to enter circulation, triggering systemic inflammation. Elevated calprotectin, a marker for gut inflammation, is frequently seen in cases of C. diff overgrowth and is strongly associated with miscarriage. Opportunistic pathogens such as Klebsiella species and Pseudomonas species further exacerbate inflammation and disrupt immune tolerance. During pregnancy, the immune system must strike a delicate balance between defending against pathogens and tolerating the developing baby. Dysbiosis shifts this balance, increasing the risk of pregnancy loss. Supporting gut health can significantly reduce these risks. Eradicating pathogens like H. pylori and C. diff, promoting commensal bacteria such as Bifidobacterium species, and reducing markers of inflammation can create a more favorable environment for pregnancy. Using the GI map to identify these patterns allows for precise interventions tailored to the individual. Pregnancy is a period of remarkable physiological changes, including significant shifts in the gut microbiome. These changes are designed to support both maternal and fetal health, but dysbiosis during pregnancy can have serious consequences. One critical commensal bacteria is Bifidobacterium species, which supports nutrient absorption and modulates the maternal immune system. Low levels of Bifidobacterium breve are often associated with poor nutrient absorption, leading to deficiencies in iron, folate, and other B vitamins, all of which are essential for fetal development. Akkermansia muciniphila plays a unique role in maintaining the integrity of the gut lining and regulating glucose metabolism. Low levels of Akkermansia have been linked to gestational diabetes, a condition that increases the risk of complications for both mom and baby. Supporting Akkermansia levels through prebiotic rich foods and sometimes specific probiotics can mitigate this risk. Another keystone species is Faecalibacterium prausnitzii, a major producer of butyrate. Butyrate is anti-inflammatory and supports immune tolerance, both of which are crucial during pregnancy. Low Faecalibacterium levels have been linked to preeclampsia, which is a life-threatening condition characterized by high blood pressure and organ dysfunction. On the pathogen side, Salmonella or even Campylobacter jejuni are concerning during pregnancy due to their association with miscarriage and preterm birth. These bacteria can cause severe systemic inflammation, which can disrupt the maternal fetal interface. Addressing these imbalances through targeted interventions, whether it's boosting Bifidobacterium species, increasing Akkermansia, or eradicating pathogens, can significantly improve pregnancy outcomes. The GI map provides the detailed insights needed to take this precision approach. Breastfeeding is more than a way to nourish infants. It's a microbiome seeding event. The composition of a mother's gut and breast milk microbiome directly shapes her baby's early gut health. Research shows that breast milk contains oligosaccharides, a specialized type of carbohydrate that selectively feeds beneficial bacteria in the infant gut, particularly Bifidobacterium breve and Bifidobacterium infantis. Bifidobacterium breve is a key player in infant gut colonization. It produces short chain fatty acids like acetate, which can lower gut pH and inhibit pathogenic bacteria. Low levels of this species in breastfed infants have been linked to increased risk of colic, eczema, and even food allergies. Supporting bifidobacterium levels in mothers through probiotics or prebiotic rich diets can significantly improve outcomes for both mom and baby. Another crucial species is Lactobacillus species, which is vital for maternal breast milk microbiota. Lactobacillus reuteri and Lactobacillus fermentum have been shown to reduce the incidence of mastitis and support milk quality. Low maternal lactobacillus levels can lead to an imbalance in the milk microbiota, increasing the risk of infections in both mom and baby. On the pathogen side, dysbiosis in the maternal gut, marked by the presence of Candida albicans, Klebsiella species, or Enterobacter species, can negatively affect milk quality. These pathogens may increase the risk of infant gut dysbiosis, leading to long-term immune and metabolic issues. Maternal Akkermansia muciniphila levels also play a role. This species, which feeds on mucin in the gut lining, supports gut barrier integrity and influences systemic inflammation. Low levels in mothers can result in poor microbial transfer to the baby, increasing the infant's susceptibility to infections and inflammatory conditions. Breastfeeding outcomes can be improved by addressing maternal gut health. Using the GI map, we can identify imbalances, eradicate pathogens, and support beneficial microbes. Strategies such as maternal supplementation on specific probiotics, increasing prebiotic intake, and addressing dysbiosis are all actionable steps to enhance breastfeeding success and infant health. Pediatric health begins with a robust and balanced gut microbiome. The first 3 years of life represent a critical window for microbiota development, and disruptions during this time can lead to lifelong health challenges. One keystone species for pediatric health is Faecalibacterium prausnitzii. This is a major producer of butyrate. Butyrate is a short chain fatty acid that reduces intestinal inflammation and supports gut barrier integrity. Low levels of Faecalibacterium in infants and toddlers are strongly associated with development of eczema asthma, and other atopic conditions. Another important species is Roseburia, which can convert dietary fiber into short chain fatty acids. This process not only reduces gut inflammation, but also modulates immune responses, lowering the risk of food allergies. Studies show that low Roseburia levels in children correlate with higher rates of allergic reactions to common foods like dairy, nuts, and eggs. Bifidobacterium infantis plays a foundational role in gut colonization during infancy. These species digest human milk oligosaccharides, or HMOs, creating a healthy gut environment and protecting against pathogenic overgrowth. Infants with low bifidobacterium levels are more likely to experience colic, poor growth, and disrupted sleep patterns. Pathogens like Giardia or Cryptosporidium are frequently detected in children with failure to thrive syndromes. These parasites disrupt nutrient absorption, leading to deficiencies in iron, zinc, and B vitamins. C. diff, another concerning pathogen, is often associated with antibiotic use and can cause severe intestinal inflammation, exacerbating issues like diarrhea and malnutrition. Early interventions are key to optimizing pediatric health. And through the GI map, we can identify imbalances and tailor interventions to support keystone species while addressing those pathogens. Probiotic supplementation, dietary modifications, and pathogen eradication can set children on a path to thriving and growth and development. Here is a woman who was diagnosed with Graves' disease and had a miscarriage. This client's GI map showed the presence of Streptococcus species, which has a direct link to miscarriage risk. There's also the presence of Citrobacter frundi and Fusobacterium, as well as elevated beta glucuronidase, showing that we will have an imbalance between estrogen and progesterone. Further, we have the presence of two different parasites, knowing that her immune system will be overactivated. I want to give a warning here. In the next image to follow, there will be a child's eczema displayed, and there is blood in the picture. Understanding microbiome imbalances is only the first step. The true power lies in targeted interventions. Here we have a child who had terrible eczema, and nothing that the parents were doing was resolving it, including topical steroids. What this GI map shows us is the presence of an overgrowth of Staphylococcus, which we know can overgrow on the skin first. We have the presence of a parasite, which will lead to an imbalance in the immune system in the GI tract and an overactive immune system in many cases. Many of the protective commensal bacteria are missing or low, and one of the commensal bacteria, Enterobacter species, is actually overgrown, causing it to act as an opportunistic or dysbiotic inflammatory microbe. Further, this child's elastase markers was below optimal, and we know that children usually have high enzyme output. So seeing this come down tells us we're not digesting and absorbing our protein, which is going to help with those amino acids for building up the skin. And those same nutrients necessary for adequate digestion are also necessary for an appropriate immune response. We see here that he has a very big immune response in the gut to gluten, and so elimination will be beneficial for him. Understanding the GI microbiome is important for being able to support perinatal and pediatric health. Let's break down practical strategies for improving outcomes in fertility, pregnancy, and pediatric health. Probiotics are one of the most effective tools we have. For fertility and pregnancy, strains like Lactobacillus rhamnosus GG and Bifidobacterium breve are invaluable. Lactobacillus rhamnosus GG has been shown to support immune modulation and reduce inflammation, which is crucial for implantation and pregnancy maintenance. Meanwhile, Bifidobacterium breve enhances nutrient absorption and reduces the risk of gestational diabetes. Dietary modifications are another cornerstone. Increasing fiber intake supports butyrate producers like Faecalibacterium prausnitzii and Roseburia. Eliminating processed sugars and refined carbohydrates reduces the growth of opportunistic pathogens like Klebsiella species and Enterobacter species. For pathogen eradication, we have a variety of tools. Herbal antimicrobials like berberine or oregano oil can effectively target pathogens such as Giardia and H. pylori. In more severe cases, targeted antimicrobials can be necessary, or if you're a prescribing physician, sometimes an RX will be the most potent decision that is needed. But when you're guided by the GI map results, you can ensure precision. Here, in this case, We have an eczema pattern. The markers that I want to look at when eczema is a concern for a client are Yersinia enterocolitica, Bacteroides fragilis, Enterobacter species, Faecalibacterium prausnitzii, Enterococcus faecalis and Faecium, Pseudomonas species and Aeruginosa, Staphylococcus species and Aureus, Prevotella species, Candida albicans, and Candida species. After working together, these were the results of this child after only 4 months with a retest. We can see that his beneficial microbes are increased. So many that were low or below detectable limits are now registering. We still have some Staphylococcus present. However, many of the other opportunistic microbes are either within normal ranges or not detected at all. The parasites that were present on the first test are gone. His elastase marker, which was below optimal, especially for a child, is now way above in a range that we want to see. His occult blood FIT, which was elevated on the first test, is now at a 1, and the anti-gliadin IgA that was off the chart high is now registering more in a normal range. And so we can see in just a few short months by being guided with a GI map, a child's skin has begun to heal. Interpreting GI map results can feel overwhelming, especially when dealing with complex cases. That's why I created the GI Map Simplified Guide. This comprehensive resource is designed to help you confidently interpret test results and apply actionable protocols in your practice to kids and to women in their perinatal stages. The GI Map Simplified shares specific interpretive patterns for thyroid health, the eczema pattern, a pediatric growth pattern, a pattern for hormonal dysregulation, a pattern for autism, a pattern for oral health concerns, a pattern for miscarriage risks, and more. The GI Map Guide includes step-by-step instructions for analyzing key markers, from pathogens to keystone species. It also provides clinical pearls for addressing common conditions like infertility, gestational diabetes, and eczema, all with considerations on when to consider other testing as well. With protocol templates for each stage, fertility, pregnancy, breastfeeding, and pediatrics, I offer practical, evidence-based solutions that you can implement immediately. You receive dosing guidelines for every supplement, descriptions on what kinds of supplements to consider based on results, and lists of supplements to use for the general adult population for pregnancy and breastfeeding and even pediatrics. Whether you're new to using the GI map or looking to deepen your understanding, this guide is your go-to resource. By using it, you'll not only save time, but also achieve better outcomes for your clients. Thank you for joining me today. I want to encourage you to take the next step by ordering the GI Map Simplified Guide. This resource will equip you with everything you need to confidently interpret results and create personalized protocols for your clients. Together, we can empower families to achieve optimal health and well-being starting from the gut. Thank you.
For any questions or issues you may have, please contact Avexia Diagnostics by email at info@avexiadiagnostics.com or by phone 5 days a week at extended hours, 8 a.m. to 8 p.m. Eastern Time at 888-852-2723. Thank you, Nina Marie, for this informative presentation. Thank you all again for joining us. Until next time, from everyone at Avexia Diagnostics, stay healthy, stay safe, and we wish you all the best on your pathway to wellness.